Hello everybody and welcome back. This is DrMridula V. Amarnath here. So how is your journey of pregnancy going? I hope it's going perfect, right? I'm sure there might be a little roller coaster rides here and there, but otherwise it should be a smooth, happy journey. So today I'm going to talk to you about one important thing that is called as pregnancy-induced hypertension, or what we call as preeclampsia. Now, do you know what it is? Well, do you know how it could complicate various things to you as well as to the fetus? Well, to know more, stay tuned. Well, preeclampsia or pregnancy-induced hypertension is a kind of blood pressure that is increased in blood pressure that you generally see during the third trimester of pregnancy. Now, this is quite serious because it can have an impact, a negative impact on both the mother as well as on the baby. So with preeclampsia, the mother's high blood pressure causes the baby to receive less blood flow to the placenta. As a result, the baby may receive less than optimal amount of oxygen and nutrients. And under these circumstances, the baby's growth and development is poor. So in most cases, the baby that is born is extremely small and malnourished. Now, not only to the baby, it can also have an impact on the mother. It can impact the mother's kidney, liver, brain, eyes, and even the heart. So in such a situation, it is important to both the mother and the fetus are constantly regulated and monitored by the doctor. So apart from this, probably you would also have a couple of ultrasounds that are done quite frequently in order to monitor the fetus. I thought I will share with you some simple tips that can be followed by the mother so as to make sure that her BP is constantly under control. So in addition to doing regular ultrasound checks and monitoring the mother and the fetus, certain other steps or measures will also be taken, like bed rest at home or hospital, constantly monitoring the patient's blood pressure, urine and blood count. Steroids may be given to mature the baby's lungs. Anti-seizure medications would be administered, and along with that, even blood pressure medications would be administered. So your next question would be, how do you know which set of mothers would get preeclampsia? Well, there is no particular reason as to why they get preeclampsia, but some of the risk factors, these set of women are at an increased chance of developing preeclampsia, such as those who have high blood pressure before pregnancy, or a history of preeclampsia in their prior pregnancy, or if it is their first baby, maternal age over 40 years, or if you have twins or triplets, any history of diabetes or kidney disease, or if you have a family history of preeclampsia. So I wouldn't say every other woman would get preeclampsia. No, only a very small percentage of women develop preeclampsia. But that small percentage of women would require a very, very close monitoring, and the doctors would certainly look out for certain warning signs, because if that is there, then they must be immediately taken up for delivery and make sure that the baby is being delivered out, because if not, then it can cause a lot of damage even to the mother, in fact death of both the mother as well as the baby. So while evaluating for preeclampsia, your physician would generally look for three main indicators: high blood pressure, if there is protein in your urine, or if there is extreme swelling of your hands, legs, feet, or even the face. Other symptoms that you may have are headache, blurry vision, pain in your right upper abdomen. Make sure, so if you have any history of preeclampsia, make sure any of these symptoms, if it happens, you immediately go and report to your doctor. So generally, most of these babies can be delivered either vaginally or by a C-section. But sometimes what happens is, the reason for monitoring them so frequently is that in case if any of these warning signs show up, then immediately the baby has to be delivered, like I said. And sometimes it is better to deliver the baby prematurely so that the baby can get adequate oxygen and nutrients from the environment rather than struggling inside the mother's womb. So I would conclude by saying that preeclampsia is a condition that you need to be aware of. Make sure that your PP is being monitored regularly. In case if it is high, then make sure that you follow the instructions as I have told you and take absolute care of yourself. Okay? So stay happy and stay safe. Bye-bye.